Let us now go to visual diagnosis of the limbs. The topic is edema. There are two types of edema, one called water edema and the other qi edema. Water edema is due to yang deficiency and is always pitting edema. That is, the skin pits and changes color on pressure. Qi edema is due to either qi stagnation or dampness, and the skin does not pit nor does it change color on pressure. Another classification is yang and yin edema. The former is the full type and is due to invasion of wind and dampness of toxic heat, whereas the latter is empty type and is due to a deficiency of spleen and or kidney yang. In yin edema, there is marked pitting on pressure, whereas in yang edema, there is little or no pitting. From a Western medicine perspective, absence of pitting indicates edema due to hypothyroidism. When observing the limbs for edema, we should always palpate the edematous area and check whether or not the skin pits on palpation. If pressing the skin with the thumb leaves a dent that takes a long time to spring back, this indicates water edema, or edema due to the retention of fluids. If pressing the skin with the thumb forms no dent, this indicates qi edema, which is due to qi stagnation or dampness. True edema is generally due to deficient yang. The fluid is unable to transform, transport, and excrete properly, accumulates in the space between the skin and muscles. Yang deficiency is the most common cause of edema of the limbs. Lung yang deficiency affects primarily the hands, kidney yang deficiency primarily the feet, and spleen yang deficiency both. Edema of the forelimbs may also derive from tension of dampness in the muscles, which may be associated with cold or with heat. Qi stagnation affecting the muscles may also cause edema of the limbs, in which case it will be the non-pitting type. In the elderly, edema of the limbs may also derive from qi deficiency and blood stasis. Finally, acute edema of the hands and face only may be due to invasion of the lungs by wind water, which is a type of wind cold. For treatment, we use REN 12, REN 9, REN 5, LI 10, Lung 7, Spleen 9, and Bladder 22. In summary of edema of the limbs, if it is due to lung yang deficiency, it's edema of the hands. For kidney yang deficiency, it's edema of the feet. Spleen yang deficiency is edema of the forelimbs, and so with dampness. For qi stagnation, it's edema of the forelimbs, which is non-pitting. An invasion of the lungs by wind water is acute edema of the hands. Thank you so much for your attention.